Hey guys, today I want to introduce a tool that I use in the clinic to help improve squatting, especially pain with squatting. So whenever we've got pain during squatting, the first thing I always go back to is a box squat. Using the box squat as a way to really reset a lot of the positional faults that people can present with. The problem in re-cueing and relearning that movement is often communication, and that what I'm asking the client to do and what they feel that they're doing can be different things. So in order to get the movement looking right, we've got to get the communication right in the first place. So we need them to be aware of what it feels like to be in the positions we're asking them to be in. So in order to do that, I'm going to use the gym stick as well as a Power Tube Pro band that just loops onto the fabric of the gym stick. You can probably work out some way to do this with a dowel. I just don't have the time or the know how to do that, so I use these. So let's head over to the box and get things moving. So to set up, we're just going to stand on the middle section of the band. We want to have it running right under the middle of the foot, not towards the toes, not towards the heels. And as far as knee position and setup goes, obviously I'm a little bit above that kind of hip crease at knee height, that below parallel squat position, which is absolutely fine. Ultimately, as far as painful squatting goes, a lot of people are just happy to get the bottom of the thigh to parallel, keeping a good back position. From here, we can start to then encourage people to squat deeper, keeping all of those same postural positions. So from here, generally my starting point is having the feet almost straight forward. Somewhere between 0 and 15 degrees is where I have that amount of toning out set, and the knee being directly over the ankle. The reason I use this position is because it then allows me to explore how much change from that position someone needs to be in their most comfortable position, as well as the most pain-free position. From here, we can grab the stick, pop it up over the shoulders, and straight away you can see how in this position there's no way I could stand up. That the backward angle of the band tells me that the weight is so far behind my feet that if I were to try and stand up, I'd just be jumping backwards. So with my clients, the first thing I try to get them to understand is how far forward they need to lean before the weight is then over their feet. Because they can't really stand up effectively until the weight is over top of their feet. So then they can come back off tension, re-tension, and I'll stop them once they're vertical. Show them the video, back off tension, re-tension, and as they see that change in position that they're getting, that should start to reinforce what I'm after. So if they're coming too far over, not going far enough forward, it's up to me to communicate that, or it's up to them when they look at the video afterwards to correct themselves. From here, once they're getting that appropriate amount of leaning in, we can start to look at standing up. And then as they sit back down again, we want to keep that relatively vertical band position as they come back off tension. So as they lean in and up, sit back and come off tension, we want to see the band stay within the width of the foot or the length of the foot. The closer it can stay to that middle position of the foot, the better. We just don't want to see this really far forward, toe dominant position. We don't want to see this overextended chest up, head up position where they lose that spinal integrity. We want relatively neutral spine, folding in and using that folded hip dominant position to then stand up and out of the squat. Sitting back, are they vertical? And then they can start to reinforce and repeat that vertical position with more of a touch and go type squat. Now as they improve, we can use a block to go under the feet to elevate the feet so that hip-knee alignment starts to become better and better. I don't really see much point in increasing the tension on the band. I'm much better off going to a barbell and increasing the load that way. This is purely just a proprioceptive and awareness drill. We're using the video as just a way to get feedback as to whether we're in a good position or not. Any questions or comments? Feel free to leave them below. hope this helps you guys, and I'll see you soon.